All right, now we have the absolute pleasure of having a new guest in the studio, somebody we have not had here yet, brand new, and it's his name is Dr. Kapur, and good morning, Dr. Kapur. Good morning, and you are here from Eastern Connecticut Hematology and Oncology.
Yes, I am.
Okay. Give me an idea of what ECHO is like where you are from, where you work.
Mike, Eastern Connecticut Hematology Oncology is a community-based oncology and hematology practice. Mm-hmm. Now, what does that mean? It means that we are providing cancer care to our patients in a community setting. Almost 80% of care of cancer patients is delivered in patients' own communities. And that's a fact that that is missed on a lot of people. What distinguishes ECHO? Well, what distinguishes us is that, one, we have a very, very motivated and patient-centric staff. We have almost 50 folks in our practice whose sole goal and mission is to make patients' journey in cancer care very comfortable, and it's very personalized.
Mm-hmm. Okay.
So that's the first part. The second part is when a patient comes to a practice like ECHO, they are our local patients, and they get individualized care. They have the same nurses who take care of them.
So relationships are built.
It's all about it's all about relationship. It's all about relationships.
Okay.
When you're going through a tough journey in your cancer care, you need to make sure that you have people that you can trust, mm-hmm. and you can relate to, and the people who are on the other side are sympathetic, and they provide empathy as you're going through this journey. They become partners. These people are our family. Right. They're people who we have known for 10, 15 years who still come on Christmas, who still come on New Year's, who just come visit us. We have people who come play banjo for us, and they have they do. They have accordions. They do all these kind of things because it becomes a family atmosphere. So it's all about relationships. When a patient is going through their tough cancer journey, it's a big unknown. There's so much fear. There's so much apprehension. And our goal is to make that journey as easy as possible for the patient.
That has to be the toughest journey ever. That has to be an incredible hard job or profession that you're in, just because of the fact that you're dealing with patients that are facing the toughest time in their life. Now, how do you handle that? Because you do get personal with people. I think there's no way you can't.
Yes,
I think you would have to be.
Yes, you absolutely do get very personal with your patients, and like anything else, there are times that you are run down as well because mm-hmm. of negative news.
Right.
But more and more, we're getting positive news for our patients, and the smile on a patient's face and the hug that you get after you do a good job and you get a good result. And when our patients finish their chemotherapies, they ring a bell. Right. And the entire staff comes and hugs them. That is priceless.
Absolutely, especially when you talk about a community cancer center as opposed to somebody much larger or say maybe Yale or up in Boston.
All these are very cutting-edge cancer centers, and they do a wonderful job in providing tertiary level of care. And there are certain things that we cannot do in a small community practice. But 80% of cancer care is delivered in community practices. And a practice like ECHO is really cutting edge. We have at any given time almost 30 clinical trials open. Last year, we enrolled close to 250 patients on newer cutting edge clinical trials. We are able to get the newest medicines, some medicines that are still being studied for our patients for clinical research. Mm-hmm. So tertiary care centers have their role in recognizing some of the new developments that are happening, but their role also is to provide those to the communities. So what we at ECHO have done is we've gone all over the country, and we've been able to get all kind of cutting-edge clinical trials for our patients. And in fact, if you must have even heard about the Moonshot program that Vice President Biden and President Obama has launched, we probably will be part of that as well. And we are working at a very close level with a company out of California known as NantWorks which is doing this in collaboration with the entire
Nantworks?
NANT, N-A-N-T.
Okay.
Nantworks. So we are part of that Moonshot program with them. So what exactly is that? Well, what it is that when a patient comes in and they have a diagnosis of cancer, we will be having their pathology specimen or the tissue specimen tested for a lot of mutations, lot of changes in the cells. And by recognizing those, we can see if there are targeted agents that are available for that particular patient. Now, some of these are going to be standard of care treatments. Others are going to be treatments that are still being studied. So every patient will be able to, at that particular point, once the trial opens, we will be able to provide that level of service to a very individualized and personalized level.
No, I think that's pretty incredible when you talk about, being a community center and being able to deliver that type of care. And it sounds like you get more personalized care at a center like Echo because everybody is from the community. They're all from the area. One of the things we talked about off microphone is that the employees have been there for quite a long time. They don't come and go. And they're able to build the relationships with the patient as they are, as far as the patient-doctor relationship as well.
Absolutely. I mean, I think the one other thing that happens is when you have employees that are part of your family, it is really not a work environment that they're coming in. They are really working to enhance and improve the practice with the physicians, with the rest of the administrative staff. So our nurses, our medical assistant, nurse practitioners, everybody, in research folks, everybody's doing the same thing. And everybody really goes over and beyond in finding resources for the patients. If we don't have it, we find it.
And one of the nice things that I know we had talked about briefly before is, we're talking about the type of cancer center that Echo is. Even if you were going to compare cost, we're going to compare cost of, say, Echo compared to a hospital and how much the care is there. Can you give us an idea or describe what the difference in cost is and why somebody would feel more comfortable, if they're looking at just that and coming to Echo?
Well, that is a very reasonable question to answer because the cost of care that is provided in a community private practice versus a hospital versus a tertiary care center is the hospitals and a tertiary care center, the cost differential is close to 30-40%, if not more. So a private community practice is cheaper in providing cutting-edge value-based care. I'll give you an example. The same treatment that a patient gets in my office versus getting it at Bacchus Hospital or getting it at Yale Smilo Cancer Center, the difference in cost is going to be 40 to 50%. Now, why is there a difference in cost? Well, I
was going to ask you that. Where does it come from?
Well, the difference in cost is because the hospitals and the tertiary care centers have been able to have a very strong lobby in getting better reimbursements for their services. And the excuse that they give is that they have much bigger infrastructure to maintain. So they are able to get this site of service payment on top of enhanced payment for the chemotherapies. And in a lot of areas in the country, you have underserved populations. And that has led to a program known as 340B, which was meant to be for indigent population only. But a lot of hospitals in this area and across the country have taken advantage of that. And the reason they've taken advantage of that is because they've been able to generate significant revenue with buying drugs much cheaper and billing at a higher rate. And consequently, what has happened is a lot of private practices have not been able to survive, and they have folded. And the hospitals have been building bigger networks because of that. Now, these are facts that you don't really get to know till it is too late.
Yeah, I would not have known that without you sitting here today.
Well, that's why I'm here.
Yeah. Clinical research. I'm assuming, and this is another point I would not have known, is you do a lot of clinical research at Echo as well. Can you enlighten us on that? And what kind of research are you doing?
Absolutely. The strongest part of our practice, besides our employees and our relationships that we build, is clinical research. We've been always at the forefront of clinical research. We started off very small. We started with clinical research almost 30 years ago, and it was at a very basic level. We've taken it to a new level now. We are able to provide our patients with pretty much the latest in clinical research and clinical trials, which include diagnostic trials, they include new medication trials, experimental medication trials as well. So we are able to get, let's put it this way, Echo has had such a stellar reputation in getting patients on clinical trials that we are now on the premier list of partners for research organizations to offer their clinical trials at a very early stage, which is very unusual for private practices. And I can also say very openly that probably in the state of Connecticut, there are not many private practices, that are doing as much clinical research as we are doing.
Now, why is that? Why would other community cancer centers in the state or even in New England, why would they not be doing? You'd think it would be essential.
It is essential, but it takes a lot of infrastructure. It takes a lot of commitment. It takes a lot of time. It takes a lot of investment. So with the current reimbursement marketplace, a lot of clinical research is not a financially lucrative or a profitable venture for a practice. It's a value-added venture for a practice. And for doctors it is, because we like to stay ahead of the game when it comes to new medications. And that's one of the reasons a lot of practices have not really done it yet. People are so busy in their practices seeing patients that they feel that by spending, by a patient who goes on clinical trials, clinical research, you have to spend a lot more extra time in making sure that everything is done right for that patient. So that's why one of the reasons a lot of practices in the state have not done it. And it has always been felt that research is going to be done in bigger institutions. So we at Echo have totally, broken all those barriers. And we just do it ourselves.
Inside of a small
private community practice.
That's pretty impressive. I mean, really, I would think that's kind of unheard of.
It's not unheard of, but we are taking it to a new level.
Well, it's unheard of by me. I ain't heard it.
well, now you know. And but this it's really been something that we have been absolutely committed to in our practice, and now. We can see the fruits of that. We put in all the hard work over the last 20, 25 years, has really taken us to a new level now with all these new clinical medications that are coming out that we'll be using for our patients.
Gotcha. All right, we're going to take a quick break and come back with more with Dr. Kapur. And Doctor, I want to talk a little bit about the new oncology care model.
Absolutely.
That's being instituted at Echo.
Absolutely.
All right. We'll be back with more. Keep it right here. It's Wolverine Radio. All right. We are back right here at Wolverine Radio, and we're having a conversation. Matter of fact, go ahead. Talk amongst yourselves. You guys are kind of chatty off microphone, for crying out loud. Dr. Kapur was holding court, with Paul Lash and Todd Staniski. And one thing that we omitted from the very beginning of the show is where you guys are located. Yeah, we should probably talk about that, because that actually is very important.
Well, I think
it's a big piece there.
Yes, that absolutely is right, Mike. We didn't think about it because we just go to work and forget about where we are working. But it is definitely important to know. We are in the medical office building at Bacchus Hospital on 330 Washington Street in Norwich, Connecticut. We're on the second floor, and the entire floor is Eastern Connecticut Hematology and Oncology.
Gotcha. All right, so let's talk about the new oncology care model. I'm looking at an article that was in the New London Day. And it says, Norwich Oncology Group chosen for new Medicare program. Can you give us an idea what this is all about?
Absolutely. I think this is a big feather in our cap. We are one of 3 practices in Connecticut, private practices, and 1 academic center that were chosen for this Medicare oncology care model. This is a Center for Medicare Innovation, and the project really is for us to implement resources in our practice which are going to be practice changing, which are going to be practice enhancing, which are going to provide more services for our patients. And the most important thing is going to be, how do we provide cutting-edge cancer care at a value, and we are able to demonstrate it. And like I was talking just now to Paul, that we know that we are providing cutting-edge cancer care, and we are providing it better than people around us, and we are providing it at a reasonable cost. How do I prove it? There is a lot of data analytics that go with it, that will demonstrate that we are providing all those and meeting all those benchmarks that Medicare or CMMI is looking for. So now we have implemented this program. The program started on July 1st, and we've been working very hard in our practice in implementing it. A lot of technology is being implemented. We are hiring new employees. We're working with a care partner in making sure that we are able to provide navigators in our practice, care managers in our practice. And what it is going to do for a practice like Echo is going to be able to manage the patients comprehensively and make sure that we are able to keep the patients in their homes and manage their side effects and toxicities in their homes, rather than the patients having to run to the emergency room in the evening or be admitted to the hospital. So we will have people who are actually going to be able to visit patients' homes. And if a patient is having some side effects of medications that we are giving them, or have some other medical issues that need to be dealt with, or let's say during hot days like today they are dehydrated, we will be able to arrange hydration either in their homes, or we will bring the patients into the clinic and preemptively prevent complications that a lot of our patients can experience.
It seems to me like the new program just offers a whole bunch of extensions to what you already do to, like you said, enhance the total care of the patients that you serve. One of the things that I look here, I'm reading from, looks like a press release. It's 24/7 access to a clinician who has real-time access to your medical records. Now, I'm assuming, and please correct me if I'm wrong, if you're a patient of Echo, your offices are open till 5 o'clock, correct?
Officially, the office is open till 5 o'clock.
Well, you guys are there much longer.
Yeah, but we are there much longer.
That I know. But let's say they can't call anybody. So what you're saying is that what this is saying is that they can reach somebody else that has access to their records that can possibly refer them what they can do at that moment, say 10 o'clock at night.
Well, at Echo, we've always had 24-hour access for our patients. We are available for our patients. So there's always a physician on call, 24 hours a day, 7 days a week, 365 days a year. And the physician has access to the patient's electronic medical records. So we are already ahead of all that, and we've been providing those services.
So you're already past that.
Yes.
Okay.
But what this does for us is even better. What it does is that it gives us additional resources that if a patient calls us at, say, 8 or 9 o'clock at night, and that patient is having some issues, we will have resources that can be deployed to take care of the patient in their own home. So we will have nurses, we'll have navigators who can deal with a lot of these things ahead of time. And our goal is going to be to really minimize those ER visits in which the patient has to stay in the ER for 6 or 8 hours before they are, discharged, or they get admitted for a 23-hour observation in the hospital. And that's the whole idea, that preemptively take care of complications, side effects, problems that the patients might be experiencing. So this project is going to be, they will allow a practice of our size to be able to implement a lot of those resources within the practice itself for our patients, number one. Number two, it also gives us time and having personnel to look for resources for our patients that we can now provide them, which includes medications, assistance, which includes, let's say, simple thing, these things you don't think of. I didn't think of it when I went into practice, which is, a lot of patients don't have access to a ride. They don't have somebody who can bring them back and forth for their appointments. So we will have some.
That's part of this program.
This program is totally comprehensive. So we'll be looking at lot of resources. Even now, we are building a database of all the existing resources that we have in our practice currently, along with local resources and regional resources in this area.
Now, also, that would also encompass a social worker?
It'll encompass a social worker as well, yes.
One of the things that you say is a practice of our size. And you say that, but it's from what you're talking about and the material that we're covering, it sounds to me that the practice of your size is actually much larger. It sounds much larger and more comprehensive than other places. And this is all in a community.
It is.
Cancer center.
It is absolutely. You know, one of the things that, fortunately, our mission as a practice has always been that we have taken the mantle of taking full responsibility for our cancer patients. Mm-hmm. It's not that you just come in, get your chemotherapy, and you leave. We have, taken this to in our own practice model, have taken it to a level that we want to provide everything for our patients. It's our responsibility as a community private cancer center to provide all those resources for our patients. And wherever those resources are, we'll get them.
That's pretty amazing. I mean, because I know for a fact, you guys are your practice is incredibly comprehensive. I kind of know somebody that works there.
You're absolutely right.
Yeah. And I just how I echoed, no pun intended, things back to you, about what you said, and it's just proof positive they do listen because she'll say I won't. She say I does not. I do not.
Well, I would not go there, but I know you. I know that you are listening to me. What happens with Lee, who is part of our practice? That is well said.
I have no idea who she is, but I do know she will come home some nights. She will just sit, and I know for just watching her, she is emotionally invested, and I'll say, honey, what's wrong? Nothing. What's wrong? Nothing. No, nothing. She gets real mad. She won't say anything to me about anything, but you can tell it's eating her up. Something that happened with interaction with the patient because she cares. She honestly cares, and you see that with. I've walked in there many times, and you can see the level of care in the nurses, and they care, and I think that's a huge for any practice. When you see that, when you see the facial expression of a doctor, you see that of a nurse, or even the medical assistants, a lot's to be said. A lot's to be said for that. Instead of just somebody walking around robotic, which you'll find in different places. I've never seen that at Echo.
Well, if you didn't care, then you would not be able to do. You'll not be able to do a job like being an oncology care professional in a practice of our size. And I think a lot of innovation is going on in the practice, and we can see it ourselves. And Lee can attest to that if you ask her. That there's so much going on, and one of the reasons she's probably upset is because I got an email from her. Late at night, one evening or night, and I was going through my emails because she was doing some inventory management for the practice. So there's a lot of cutting-edge, innovative stuff that is going on at individual level in the practice. And that's the whole idea, that how do we make ourselves even better?
You said late at night. I'm thinking, what, 1, 2 in the morning?
No. It was in the evening. So it's people who, once people care about what they're doing, and they really are invested in the practice process, that's when you see good things happen.
Yeah.
And that's what we are seeing in our practice now. We have the right people who care and who really want to improve the practice. And they have that opportunity and the independence to do it. Let me put it this way. I don't understand a lot of things that go on in my practice, but I know we have the right people to do those things. Mm-hmm. And those right people are going to make us more successful.
And that's the biggest piece right there, the right people.
Absolutely. You have the right people and you let them fly.
Yeah.
And let them do it, and they will come back and improve the practice even more. I mean, Lee and other folks in our practice, they will go over and beyond in getting medications for our patients. They figure out ways, which is unbeknownst to us, they figure out ways to help patients. There's so much that is going on in the background that never is seen. But how is it seen is when the patients come and say thank you. They don't come and they don't come. They say a little thank you to me, but they say a big thank you and a hug to all the nurses. And that's when you know you're doing the right thing.
Yeah. And not only that, but it's cool. Like Lee will come home with gifts, like a card or something, or a balloon or something that somebody had stopped by one time. It was a BMW. It was, I mean, some pretty cool stuff that.
Well, you got a BMW, but I didn't get that.
No. That's. Well, it was a sandwich from Subway. That's what. Oh, it's a BMT. Yeah.
Well, it's very funny. That you mentioned that. I have patients who will bring me. They go hunting and all, or they go fishing, and they'll bring me
like a dead rabbit. Or?
No, not
a cat does that.
No. Well, whatever they bring is very clean. Let's put it this way. Or I have a patient right now. Yeah. Every time he comes in once a month, and believe it or not, every time he comes in, he'll bring either a squash or a zucchini or a tomato that he just leaves on the table for me. It is amazing. It is just truly stunning really cool. And amazing that you have such. You got to realize a lot of these patients are going through real difficult times. But even in their difficult times, they are, these wonderful human beings who really care about what they're getting and the relationships they have. If they didn't think so, they would not be doing it.
That is pretty amazing. I thought you were going to say they dropped you off like like concert tickets or something like that.
No. No, it's truly amazing when you look around the entire community around us. And how it is, it's actually a lot of fun. It's a lot of fun with what we do.
I'm sure I would, even though I'm sure there's unfortunately tragedy, and there are bad times, but I would think that the good times, while the patient is there and you're taking care of them, once I think there has to be an acceptance. I would think
there is. It's hard. It is very hard to accept that you have a diagnosis of cancer. There's a lot of uncertainty. There's a lot of fear that goes with it. But our responsibility is to make sure that we alleviate that fear, make the patients feel very comfortable. And you're absolutely right. They're not, a lot of times we're not very successful. And there are patients who don't
I don't mean
it
like that. I'm talking about like their psychological well-being. They come in. You said they're scared. They're worried. There's lots of uncertainty. But after a while, that kind of levels out. And then there comes that community piece again.
Absolutely.
Where you become almost friends.
Well, it's all about trust.
Invested in that person.
It's all about trust and relationship.
Yeah,
comes down to a very basic human relationship.
Yeah.
Trust. If you trust somebody, you're upfront with them about what they have, that you're going to take care of it, and you'll find whatever resources you need to do to make sure that their journey in their cancer care and their fear and apprehensions will be also taken care of as we are going through that. I think you've done a good job.
Is there anything else about the new care model that maybe we didn't touch on that you want to talk about? I don't want to leave anything out. Oh, that's our account executive, Teresa.
Oh, okay.
Wasn't it? Was that Teresa?
No.
Oh, you know what? We have a guest on after you.
Okay, very good.
She's a psychic.
So it's time for me to leave.
She didn't know it was time.
She was a psychic. She had no idea what time.
Oh, okay. Well, looks like the readings didn't go right. No, the only thing I would say is, we are just implementing we just started the implementation of the oncology care model, and we are very excited about it.
Yep.
And it's a great privilege and honor for our practice to have it.
Yeah.
With all the right things and the right mix of people working together, we will make this very successful.
Right.
So probably what I would like to do is, the process has just started. It's a 5-year project. I think probably.
I was just going to ask you if it was like a test market type of thing, if it was a research piece, or okay.
It's a 5-year project. So what I would like to do is probably in a few months come back and give you a little update of where we are.
Absolutely.
And what services we've implemented, and even might bring in a couple of our employees who have come in to do these things.
Yep.
And even talk about our clinical research portfolio.
That would be excellent.
Just educate people as to how many new things are going on. Right here in southeastern Connecticut, in Norwich, which is just amazing.
Yeah, and I think that's very important that we continue this dialogue here, so we can deliver these messages to the people that listen to them. I mean, both of them. We have 2 listeners, so and they're listening right now.
We hope.
Paul and Todd, and no, but I think it's very valuable information, and it's a lot of times it's something that people just don't want to talk about. They want to kind of sweep it under the rug a little bit, and it's not happening. And but it's important and it needs to be discussed.
Well, so many things have happened in oncology, in cancer care, and so many new medicines. Our goal has always been that we want to make cancer as a chronic disease as much as we can. And we are getting there with all the new immunotherapies, new targeted agents. We are getting there. We're not completely there, but we will get there over time.
Well, hopefully, during our continuing dialogue with here, we'll find more and more and how close and how Echo is coming to beat this terrible thing called cancer.
Well, we are sure working on it.
We're a lot alike.
How's that?
He's probably thinking there is no way, and Lee's already shaking.
Well,
her head.
let's find out.
Well, Echo is these two guys here. They're like, oh crap, where's he going? we're both all about community.
Absolutely.
That's what this radio station is. It's all about community, and I know exactly what you're talking about. How you say about how you care about what you do. We do the same thing. So we're brothers.
I agree with you 100%.
I thought you were going to say people leave you squashed too.
No.
You want to know something? Last week, somebody brought to the station a bag of squash. I'm not kidding you. No joke, I can't make this up. And they put it on the door, and I brought it into the station. They put it right there, and I went, I'm not touching that. That thing's been injected with something. Because we said something to piss somebody off. So right behind you stood a bag of squash. So I'm thinking, he brought that squash.
So you have two things in common.
So I think we have two things in common.
The Squash Brothers. Bring it in.
That's awesome.
Hopefully you will come back.
I absolutely will.
After this experience, maybe.
Oh no! I think now that we are Squash Brothers,
We're Squash Brothers.
as long as you didn't say rotten tomatoes or something like that, I think we should do it. I would really like to come back and give you an update on how the oncology care model is progressing over time.
That'd be excellent.
And we have some research, etc. And anything new and novel, innovative going on in the practice, I would love to share it with your audience and with the community.
Very, very good. And not only do we do the interview here, we also put it up as a podcast so people can review it later on. If there was something that you had said that they went, I didn't get it, they can go back and they can listen to it.
Wonderful.
Which is really good. All right, Dr. Kapur, everyone from Echo, Eastern Connecticut Hematology and Oncology. There's our studio audience. I'll go ahead giving them a round of applause. All right, we're going to be back with some more stuff right here on Wolverine Radio. It's Friday, which means you never know what's going to happen. Neither do I. People just kind of walk in the door as they get here. And we last week we had a psychic medium in here along here on Friday morning at 9 a.m. And we're going to do it again this Friday at 9 a.m. where we have another psychic medium. She's a channeler, and she's going to be in right after the 9 o'clock hour, right after news with Phil Michelle, right here on Wolverine Radio. Dr. Kapur, thank you very much, sir.
Thank you very much.
Wolverine Radio. It's got some bite.